So based on our experiences, you probably know that already, that we are designers and specialize in designing and researching and also developing different solutions applications, also in the healthcare industry. We've gathered some experience and some examples and some of best practice or worst practice or mistakes that we made or observed that were being made in different projects, and we would like to share it with you today.
Yeah, I think it's good to admit that it's a challenge. Defining the challenge is a challenge not only for organization, for business, but also for us. So it's not it's a session also which is our part where we admit to our mistakes or not necessarily wrongdoings, but some things that we probably would have done differently today if we had a chance, and we have a chance. So we trust in sharing and giving feedback and sharing our expertise for the benefit of the projects that we quite often do together. So for today, we of course, because defining the challenge is it's one of the essential and one of the first steps in the journey of delivering your project or your product or your service. We would like to focus today on research, on solution, and on toolset.
Yeah, we are a huge fan of research, both of us, and especially, and this will be stressed today, I think this is qualitative research. So yes. Not only quantitative, but qualitative.
But this is not the session in a moment when we tell you that, oh, you need to spend 4 months on working on your research before you start doing anything. We understand how the reality of the projects in organizations look like, how much time you have for the project, and how much budget you have for the project and resources. And we want to address that and give you some tips how to incorporate reasonable research or the minimum research into your projects.
Minimum viable research.
We need to put a tag on that.
Yeah, trademark.
So minimum viable research and how to incorporate it at different steps of the project, because I trust that most of you are already running at least one. So, but the research can be useful at various stages, and that's what we want to discuss today. But research is one thing, but we quite often start with solution, and I think that's something natural. We are kind of hardwired as humans that if you have a problem to solve or you want to push things forward, you start with just thinking about the solution and how to implement it, and not necessarily what's behind the whole challenge you're facing.
Yeah, the reality is that the ideas for projects come from different places in the organization and come from different people, and sometimes those people know the challenge very well, and sometimes they know the problem very well, but sometimes it's more like a business idea, or it's the need for the business or for the organization. But the question is if it's actually the market need, or or patient's need, or a doctor's need, or a nurse need. And I think this is something that we often see that there is the tendency to start to adopt some idea and to start building it immediately without actually trying to dive deeper into the topic. And we need to realize that we have a lot of stakeholders. So we have insiders, we have people, we have business people, we have marketing department, we have the board, obviously, we have sales. But in this industry, the patient and the doctor and any medical personnel is actually should be at the center, and it should be asked first, which is not always happening, let's say.
You can have a really great, successful, and inspiring brainstorming session when you gather creatives and your team and you start working on the solution, how to solve it. But if you don't back it up later, or preferably start earlier, at least a basic research among your target group, among either healthcare professionals or patients, then there's a risk that you're going to deliver something that's going to not really match the expectations of the audience. It sounds tribal a bit, but it's still a thing that we are also facing in our daily and daily work. We also have a tendency to jump into the solutions and think about what should be delivered without spending enough time on why, for whom, how, and what the audience actually needs. So the idea that you have at the very beginning for how to solve your challenge, it might be perfect. It might be just on point. So it doesn't mean that it's not correct. But the question is, do you have enough information, and are you sure that you're spending your time and resources on the actual problem, on the actual challenge, and are you solving it in a proper way?
Yeah. So basically, you need to spend a bit more time, or our recommendation is to spend a bit more time on thinking about the project and trying to find out why you need to build and what exactly you want to build. And I think that we can admit that there is definitely some challenge and some problem with running research in this type of project, especially in the healthcare industry. So this area is quite neglected, I would say. Why do you think?
I think have you ever been tired of research?
I would say quite the opposite. So I usually research is fun when it's happening.
It's happening. I think it's hard sometimes in an organization business when you are running multiple projects and you're facing multiple obstacles. Finding time on research, which requires patience and focus, is just difficult. And when it's core of your work, it's probably easier.
Absolutely.
When you need to address it among plenty of other equally important tasks, that can be challenging. And I think that with research, there's this kind of a general feeling that it's super time consuming
and expensive, and you need huge groups.
Yeah, especially in a healthcare industry. When you think research, these are really serious tasks. Long-lasting and of course time-consuming, resource-consuming. There's security. There's lots of steps of validation. It's tough.
Yeah, because I would say that pharma or healthcare industry in general is used to very rigorous research for a reason, obviously. But
thank you for that.
But the product designer, when we are talking about design thinking process, you don't need to be that rigorous. I mean, it's not about not being proper and not having a methodology, but you don't need to be that rigorous. And I think that might be a reason why people at especially big organizations, because startups are probably a bit different story, are afraid to run the research projects and to even start the research project.
Yeah. So when we talk about, we talk about digital solutions that you offer to your customers, to patients, or to doctors, or anyone involved in your operations. So when you research and you analyze the potential digital solution, you don't have to run such extensive research as for the regular.
So how many people? 30, 100?
I've never heard of such digital research. I mean, quantitative, maybe qualitative, not really. From experience, we talk about 6 to 10 persons. That's so when we discuss a challenge, or we want to validate an idea, which we're going to discuss a bit later. When we build the initial group for tests, or for research, or for in-depth interviews, I think we start usually around 6 to 8.
Yeah, that's also my experience. So that's usually enough. People really don't trust us, because especially when we are talking to marketing department, they say like this is not enough people, because they are used to huge groups and quantitative research. So, but the reality is, after talking to 6 people for an hour, each person, like individual interviews, you really gather a lot of insights, and they start to repeat themselves. So if there are any like really important insights, if there are really big challenges that these people are facing. You probably will detect it after these 6 conversations.
Yeah, and of course, we don't talk about asking 6 to 8 absolutely random people, right?
Absolutely.
You can have a successful research just by discussing your topic with a couple of patients or a couple of healthcare professionals.
Yeah. So the screener, having a very good screener, and prepare yourself, and also recruit the right people.
Yeah. So you have the framework, and you know what you want to discuss, what you want to ask about. So you run those. So 6 to 8 interviews. What would you say? Okay.
Recruitment,
recruitment.
It's really that's the big topic. But I remember that when we had the project, when we were looking for geneticists in US, and at first glance it looked impossible. But we had some methods, and we had a brilliant researcher and very clever. And we started to use some social media, some groups, and exploring these topics. And also then, and this is this nice name called the snowball method, which basically means that once you find the right people, they know other people in their industry, and they can also connect you with them. So I would say that this is probably one of the best solutions, and it's very difficult to start, in fact. But once you are done with the first or second interview, then it's much easier to find more people.
Yeah, and what we also experience is that actually you guys have resources and you have connections, and sometimes we are able to build a test group just by talking to you, to your sales team, or to customer support team. So we've been able to find good segmented target groups among your peers, your partners, your clients.
Your reps know a lot of your users. Your patient support groups are full of really interesting respondents, I would say.
So it doesn't mean that you need to reach to another company and spend more time on just recruiting the right people. This has become really, really easy. So it's quite possible to wrap up your whole research in 3 weeks?
I would say, it's still pretty ambitious, but it's possible. It's definitely doable.
Yeah.
So it doesn't mean 6-month project and delaying the delivery. So you can spend a few weeks, 2, 3, 4 weeks, and you can get very, very good insights.
So you just had your 3-4 weeks research phase, and you find your first insights. And
insights are opportunities.
Opportunities. So right. So what did you do? You have 6 interviews, and there was one really strong, interesting thought. How you build?
Yeah, I think that very often when we have these insights and we go to the committee or we go to the team, it turns out that they are either neglected or they are being challenged. So it's not feasible. It's too expensive. It's too difficult to change our own processes, and I think that this is this initial situation, or this initial challenge approach is quite natural as well, because we as human beings, we don't like change. We are afraid of challenges. We want to avoid challenges very often, right? So the question is how not to ignore those opportunities, how be a little bit stubborn, a little bit trying to be really resistant to this critique and those challenges and obstacles, and try to find the root cause of this situation, and try to cherry pick maybe, and skip the ones that are really not possible to implement, that are not feasible, and try to differentiate them from those that are difficult or challenging, but definitely doable.
But do you think you can grow your insight just by, you find something interesting and you can have a quick follow-up, like a really short validation research, just to make it, keep it minimum viable research, but have some more quantitative or fast checkups of your thoughts, especially in the healthcare industry? Is it so? Can you? Because from my experience, we did it by just running some really quick exercises with follow-up surveys, but also with some very simple prototypes and quick actions to get to reach sometimes the same people or more people and get the feedback on the more clarified insight and idea.
Yeah, absolutely. That's I think the approach we are also sharing, and the notion that we have. So we've been working on a different tools, and for example, one of them was a software for managing a medical practice. So the software that was operated by reception desk personnel and also the doctors. And what we did after we had some initial thoughts and some prototype, we just conducted some ethnographic research. So visiting people at their workplace, showing this prototype to them. And this way you can definitely find out what is actually happening here, if there is anything relevant, if there is anything valuable. And in this case, we were able to modify our prototype, this early prototype, and adjust it to the actual needs of the doctor. So, for example, have each crucial piece of crucial information on just one screen. So because the doctors are really pressured in terms of time, and the visits and the administration of the visits should be as little as possible. So that was the insight that probably wouldn't be possible without actually visiting the doctor's office.
So that's because now this is the scenario when you didn't start your project yet. I mean, that development or ideation phase. So, and you are lucky to have this research phase. But this approach and this ways of work, it also applies to the projects you are already running. You can improve your project, the one you're currently, or the product you're currently building, or the service that you're creating, just by doing the additional research at this stage where you currently are. So it's always worth to go and ask and look for the insights, for ideas, and improve what you already have or what you already are developing.
Yeah, but it's also really important to when you are conducting this validation research or validation check, to try to avoid your biases and try to stay as, let's say, objective as possible. And remember that especially if it's the same person running the research and designing the product, there is a tendency that you want to somehow. Sometimes you need to kill your darlings, right? So basically, it's difficult because you have to distance yourself to your work. But
let's improve your darlings.
Or or keep some of them and improve the others. But you have to remember that changing the earlier you change, the cheaper it is to change. Because once the product is there, once it's coded, and coding implementation is really expensive nowadays.
From our development perspective, whenever the later the update comes and the insight comes, the more difficult and complex it is to adjust what you already have to it. It is possible, but it's challenging.
Yeah. So basically, like investing in research early is much more. I mean, provides much better return on investment.
And saves your time and budget. But so that's one of the thoughts is that this is a process that it's an ongoing process, and it's already also you should keep it for your existing products, right? That's kind of it's not just for your fresh ideas and fresh projects. This is something, the mindset that you can adapt to basically all your digital operations that you're running, internal, external, like focused on patients or healthcare professionals, related to sales, to logistics, to everything basically.
Yeah. So actually, a good thing and a bad thing about digital products is that they constantly change and can change. So it's not a building. You can rebuild it very quickly. You can adjust it. You can optimize it. And also the environment changes. So basically, the legal context is changing. The patients' needs are changing. The technology is changing itself. So so even the website that was built 3 years ago might be already a bit outdated, but that doesn't mean that that you have to start from scratch and you want to and you should just
probably you don't need another website.
You probably don't need another website. First you should check if it's working properly. Check the analytics, because very often we see that when we talk to the pharma industry or to other healthcare organizations, they somehow neglect the statistics and the data they have. And this is especially when you have a running projects, you have a really valuable asset in having this data.
And if you need another website or another solution channel or anything new on your digital ecosystem, then learning and evaluating what you already have will make your challenge, or the definition of the challenge, much more informed and better adjusted to your needs.
Because it's probably not the medium itself or not the tool itself, but the way it's used and the content, and also how well the patient's or doctor's journey is mapped onto your content and onto your tool.
So the challenge lies not necessarily in the technology or solution, but also it lies in the context between your audience and the content you are serving them during various channels and touch points. So that's one of the what we want to say, that don't give up on what you already have. There's a space for improvement, and always analyze your ecosystem, how your customer's journey looks around your patient's journey, how it looks in different contexts and different steps, and then so that means also looking for insights and observations through research in various places of this journey.
And you can also use your existing tools and make them and run the research with those tools. And this is also very good approach, I think. So not starting from scratch and with a prototype or fresh ideas, but trying to challenge what you already have.
So asking a lot of whys in the process.
Yeah. And this is also it's not that easy, because sometimes you are so fed up and with what you have already, and
never.
Yeah. So and want something new and shiny, but I mean those are simple answers and probably not the right answers that are addressing the root cause of like you don't have enough traffic, or the patients are not signing up for research, or they are not, your site is not visible in Google. So and changing it, or like translating this everything into mobile application won't solve your problems.
Yeah, that's true. About solving problems, one last point we wanted to discuss briefly today. So that's ignoring the elephant in the room, which might not be the best phrasing we used, but what we want to say when you're framing your challenge and start thinking about the solution, involve all the needed departments from the very early stage. In a digital industry case, I would recommend that this is IT, because there's already a lot of knowledge, solutions, and experience on the IT side, and whatever is going to be delivered is going to be eventually handled to them. And the second,
this is definitely the legal team. So we've also, mentioning the healthcare industry, we know how important the being or working according to the legal system and the expectations is, but it's definitely challenging topic, and we know that we've seen a lot of projects being challenged and being delayed by not involving legal department from the very beginning. And you have a lot of regulations. Again, this is very good thing, and we appreciate that, but that also means that you need to operate within the limits, and you need to take this into consideration from the very beginning.
That's true. So just to summarize, as I mentioned, we're going to send this later to you, but this is what we mapped as important on the very early stage when you're defining your challenge, especially in the digital health industry. These are also best practices coming from other industries. So because we learned on different fields, but this is something that will set you up for a better journey with better results, and more. And I would say everything's going to be a bit more predictable. And I think this is also what we are looking for, to know where we're heading and why we are heading that. If you have any more questions, because we scheduled a short session, but probably, as you see, we're able to talk for hours, but that's not, I mean, we are all at work, so just a 30-minute session today. But you would like to discuss more of these topics with us, or you have any thoughts, or you disagree with us, we love to be challenged. So then please contact us. We can schedule a short free consultation session. We can schedule another meeting, or we can just have a really interesting discussion on LinkedIn, or on other channels. I'm gonna share a quick, just to make sure. Sorry, and I see that I clicked on the wrong thing. Yes. Okay, I tried to share a link to our website when you can look for ways how to get in touch with us. But I assume that also you will get everything in a package when we send it to you later on. So
now we have a question here.
Question, yeah.
So let's look at the question. First question. Yeah, if the research always has to be one of the most expensive part of the preparation stage of the project.
Is it the most expensive?
In comparison, I think it's still quite expensive, but as we said, I think it's still an amazing ROI opportunity.
But if you think from my perspective, you have a team, 8 persons, developers, designers, project managers working for, let's say, in this fast scenario for 4 or 5 months to deliver the first version of your solution. So comparing to that, 2 or 3 researchers working for 3 or 4 weeks and supporting the design phase, the ideation phase, the development phase, the project management phase, everything is kind of connected to that, then I think that we talk probably about more like savings than costs.
Yeah, that's a good point, because very often the organizations don't count their own time. So for example, the time spent during the meetings, during endless discussions about the goal of the project, and trying to find arguments like what should be the shape and the scope of the project. Whereas I think it's sometimes much easier and much better solution to base your decisions on data. So basically to gather those insights and to trust on what you hear from the patients, the doctors, instead of trying to convince yourself according to your gut feeling.
Yeah. So it's 12:30, and at least here in Poland. So thank you for joining us. And if you would like to follow up with the discussion, as I mentioned, we'll be super happy to continue. Feel free to find us on LinkedIn, reach to us via email or through our company website, through Edisonda or through Noah Ignite. And we would like to continue discussing it and also learn more from your expertise. And it would be great to switch this webinar into our additional research project when we can get more insights about your needs and expectations and your challenges that you're facing while delivering any type of digital projects.
Yeah, thank you for your participation, and hopefully that was a bit of inspiration for you, and good luck with your with your project, and don't neglect the research, and try to spend more time on thinking before doing.
Yeah.